Hello, I am Dr. Amber Hasty-Mills, psychologist at Glenwood Incorporated. Glenwood is dedicated to helping people on the autism spectrum, people with behavioral issues, and their families. After a diagnosis of autism is given, we have a few minutes to explain to families what to do next. One of our suggestions is to learn all you can about autism and what to look for in therapists and therapy models. Since that information is given quickly and at an overwhelming time, we wanted to produce easy-to-access videos to further help parents and caretakers. We wanted to produce these videos so that they could be watched at times convenient for you. We also wanted to give you information in layperson's terms, not medical terminology that can be sometimes hard to grasp. We do hope that these videos will be helpful for you. We want to introduce you to the Picture Exchange Communication System, or PECS, a common communication system used with individuals with autism spectrum disorder. This system is helpful for individuals who are nonverbal or delayed in language. This video is meant to provide an overview and is no way a substitute for consultation or therapy with a licensed practitioner. We recommend that families consult with a speech-language pathologist, a behavior analyst, special educator, psychologist, or other professional for more information on how to use PECS at home or in the school. PECS is an evidence-based treatment that is used with individuals with autism, as well as other individuals with communication needs. This system uses pictures to communicate needs and wants. It is also used for responding to questions and other forms of social communication. PECS can be used with children who are verbal or nonverbal. Using the system does not mean a child will not be able to talk. On the contrary, some research shows that PECS may make it easier for some children to learn to speak. However, it should be noted that this will not be true for all children. When using PECS, a child is taught to identify pictures and use those pictures to request and communicate with others. A child's individual needs are considered when developing a PECS program. There are official PECS trainings as well as online modules that teach PECS in more detail. In order to use PECS, one must teach the child how to use and interpret the cards. This typically takes two people, one who is communicating with the individual and one who is helping with the cards. The helper physically assists the child with taking pictures and giving them to the communicative partner. Select pictures of items that the child enjoys and would find reinforcing. When the helper assists the child with handing a picture to the communicative partner, the item in the picture is immediately given to the child to reinforce the behavior. This is how the child learns that when he or she is using the card, he or she gets something in return. In addition, the child starts to learn what each card represents. A picture of a cookie gets them a cookie, and a picture of a teddy bear gets them a teddy bear. After the child learns the basic concepts of PECS, that cards represent items that can be obtained, he or she is given an opportunity to generalize what they know by using the cards with other people and increasing the number and type of cards that are used. In the PECS process, the child's distance will gradually be increased from the PECS binder and from the communicative partner. Part of this phase requires that the child be able to get the binder filled with PECS and give it to the individual with whom they are communicating. As the child learns to pick up the card, the helper may guide the child's hand toward the communicative partner. After the child learns to give the card to the partner, then the helper may adjust assistance by simply pointing to the correct card. This is an example of fading prompts. In the next phase of learning PECS, the child is taught how to discriminate between two pictures or how to tell them apart. The helper starts with two pictures, one of which is something highly desired by the child. The other picture will be unrelated initially to avoid confusion. For example, the child may be asked to discriminate from a picture of chips versus a toy train. The helpers use different prompts to aid the child in telling the difference between the two pictures. Some children may have difficulty distinguishing between two pictures. For children who have difficulty learning to discriminate, the object may be placed in front of its corresponding picture. The picture is then gradually moved further away from the object once the child has started to learn the representation. Once the child learns to tell the difference between two pictures, more pictures are gradually added. To move on to the next phase of learning, the child must know 15 to 20 PECS cards, be able to discriminate between 3 PECS at a time, and independently retrieve the cards and give them to the individual with whom they wish to communicate. The next step involves sentences. Sentences are created on a PECS board using a PECS symbol for I want, with an open space available for the PECS card. The child is taught to place the desired PECS symbol next to the I want picture through a process called backward chaining. The child is expected to place the I want picture next to the picture of the desired item on the communication board, give the board to the communicative partner, and then point to the pictures in order to move on to the next phase of learning. Next, the child is taught to respond to specific questions, such as what do you want? The teacher will ask the question and prompt the child to give the PECS board to him or her. Again, a hierarchy of prompts will be used here, moving from hand over hand to partial physical guidance to gestural cues to verbal cues, and eventually no prompts. The last phase in teaching PECS is using PECS to respond to other questions. These questions may be more social in nature and not necessarily used for requesting. For instance, helpers may teach the child to respond to questions such as what do you have, what do you see, and what do you hear. To end this phase of teaching, a child is expected to spontaneously use PECS to make requests and comments. During the process of teaching PECS, data is collected to determine if the child has mastered enough skills to move on to the next phase of teaching. Studies that focus on preschool and elementary school children found PECS to be effective in developing social skills and communication. It was also effective in teaching communication skills to middle schoolers. For more information about evidence-based treatments and PECS as an evidence-based treatment, review information from the National Standards Project at www.nationalautismcenter.org. There are many ways to develop PECS for personal use or use at school. There are several PECS computer programs, including BoardMaker and Vizzle. PECS may also be created from photos or clip art. Examples of some PECS that are used in a classroom setting are shown here. To access an internet training module on PECS, visit the Autism Focus Intervention Resources and Modules website at affirm.fpg.unc.edu. Additional resources and training information may be accessed through www.pecsusa.com. Furthermore, a toolkit on visual supports may be accessed via Autism Speaks website. Visit www.autismspeaks.org and click on Toolkits. For additional information about visual supports, please watch our videos that discuss additional visual supports and how to use them. Thank you for watching.
This video was sponsored by Wells Fargo and the Independent Presbyterian Church Foundation.